Hey everybody, my name is Dan O'Hawk. Some of you know me as Howley Hawk, and this is my first time at this, so bear with me and have a little patience. I may stumble through this a little bit until I get more comfortable with doing this kind of thing. There's a lot of issues out there that need our attention and need our focus, and far too many for me to cover in a 10-minute video. So what I'm going to try and do is do a series of videos, and each one addressing each one of these issues as well as I can. And today's topic is going to be about healthcare. The healthcare bill, healthcare reform, however they want to control it. Sorry, Freudian slip there. However they want to call it. Um, you know, um, Realistically, there isn't a whole lot that's wrong with our healthcare system the way it is right now. You pretty much have the freedom to go see who you want and go with the insurance company that you want to. Now, of course, the high cost of everything these days makes it kind of tough for some people, and that's one of the things that they use to that they're using to try and get this through is to make it affordable for everyone. Well, you know, there's other ways of going about doing this to make it affordable for everyone. Let's talk about that for a minute. I'm going to lead into it by these people in Washington. They see the people marching on Washington or wherever they happen to be protesting, waving their signs and their banners and whatnot like that, and that's all good. And I don't judge anybody for that. I mean, I think it's good that they step out and express their displeasure as to the contents of the bill and the what they're trying to do with it. But the problem is, and in all fairness, the problem is that usually at these protests, all you see is the complaint. They don't really offer much of a solution on their signs and their banners. It's usually what they're unhappy about, but they don't really offer a solution. Well, today I want to suggest a solution to the problem. Am I bothered by this healthcare bill? Oh, you betcha I am. But I think that there's more to it than just complaining about it. I think that offering a solution is really what's warranted here. Now these people aren't dumb, and I'm sure that they've considered all of this before. But nonetheless, if they happen to catch this video and hear the solution, then they can't say, "Oh, well, I didn't know." So let's get into it. Um, um, First off, let's break it down a little bit. They call it the healthcare reform. Well, we don't need reform. What we need is regulation. And I don't mean regulation of what you can do as a citizen, as a patient. I mean regulating the insurance companies, the medical profession, and the pharmaceutical companies. Everything in this day and age is way too high priced. And it does make it rather unaffordable for a lot of people. Not everybody's rich. Not everybody makes a ton of money at their jobs, and so they have to take that kind of thing into consideration. Now they claim that that's what they're doing, but all they really have to do, they do not have to reform the whole industry. All they have to do is reform the cost. Nothing in this world costs as much as they charge. Nothing. It was proven years and years and years ago when you could buy a loaf of bread for a nickel, and now look at the cost of it. So let's start with that. If you reform, put a ceiling on the insurance companies, put a collar on them dogs, and say you can't, you can only afford, you can only charge this much. That makes it more affordable for everyone. The same with the medical treatment. The doctors are getting crazy with how much they charge, these days. So, you put a limit on how much they can charge, and then particularly the pharmaceutical companies and their medicines. Although our fearless leader might have a little bit of an issue with that, seeing as how he's a major stockholder in the Baxter Corporation, which is probably the largest of the pharmaceutical companies. But that's another issue altogether. You limit these people. to how much they can charge and keep it within reason. That makes it more affordable for everyone. You offer tax breaks to employers so that they can buy group health insurance at an affordable rate and pass the savings on to their employees so that they also can afford this health care and health insurance. Um, Another way that you guys could save a lot of money would be to stop giving illegal aliens medical insurance, driver's licenses, social security cards, welfare, all this stuff. What you need to do is to take these illegal aliens and send them back to their countries and make them do it the right way. It is not fair for every immigrant that has come into this country legally and gone through the motions and gone through the steps to become citizens, or at least to become to have the right to be here. It's not fair to them for you to take care of these people. The best way you can take care of the American people and to cut costs is to quit coddling these illegal aliens and get them out of this country and make them do it right. I do not have a problem with immigrants coming into this country. What I do have a problem with, and every single American in this country should have a problem, is for them coming in and doing it illegally and getting all the gravy benefits that the American citizens should be entitled to, and they're not. This is something that you really need to address. Close the borders and deport these illegals and send them back to the countries they came from and make them do it right. If they do it right, I'm okay with it, and I'm sure you would be too. There's I recently read an article that it was a letter that a lady sent in to the Glenn Beck show, and she's 53 years old, and she stood up and addressed many of these issues that are troubling us today. I also recently read about a teenager that got expelled from school and actually got assaulted by one of his teachers for passing out literature about vaccine awareness. Now, why on earth would they do that? Expel a kid for just telling the truth about things. But the point of this is that, here is a 53-year-old woman and a teenage boy who stood up and did something. There's a lot of people out there that talk the talk and all of that, but they're too busy sipping on their Pepsis and watching TV. You guys like to think of yourself as tough guys. Well, tough guys, it's time to set down your Pepsis, and it's time to turn your TVs off, and it's time to get up out of your easy chair, and it's time to start doing something. You need to call your representatives and tell them about this bill and tell them about the solutions to this bill, to this quote-unquote dilemma. If you just sit back and drink your Pepsis and watch American Idol, this is going to get crammed down your throat and cram down my throat. And there's 80% of the American people do not want this health care bill. Why? Because it's a joke. They don't need to do all of this stuff. When somebody comes in my house and wrestles me down and forces me to take a shot that I don't want to take, I'm supposed to be happy about that? I don't think so. And you shouldn't be either. You should all be stepping up and saying, hey, no, this is not going to happen. You are not going to do this. You're going to stop. You're going to cease and desist right now. That's about all I really have to say about the healthcare issue. Is that this is a thing that most people do not want, and yet they're cramming it down our throats anyways. When are you going to stand up and make Washington listen to you? They work for us. They don't work for themselves. They think they do. And it's time that each and every American stood up and woke these people up to the fact that, no, you work for us, and if you don't do what we want, then come November, we're going to fire you. That's all I've got to say about it for now. Take care, and I'll see you next time.